Helo, pnawn da. Fi yw Eluned Morgan, Gweinidog Iechyd a Gwasanaethau Cymdeithasol dros Llywodraeth Cymru. A diolch i chi unwaith eto am ymuno gyda fi. Thanks again for joining me. I'm Eluned Morgan, the Health and Social Services Minister for the Welsh Government. And today I want to speak to you about HIV and our ambition to eliminate new infections and to end the stigma of HIV by 2030. HIV continues to be a major global public health issue. It can affect anyone, regardless of your sexuality or where you come from. There's no cure, but people diagnosed with HIV who access treatment can and do live long and healthy lives. In Wales last year, around 2,800 people were accessing care for HIV, and there were 48 new diagnoses. We've come a long way since the dark days of the 1980s, when there was a lot of fear, a lot of ignorance and cruelty around HIV and towards people with HIV. We've made considerable progress in reducing the number of new diagnoses every year. And that's thanks to increased awareness, easier access to testing, and the wide availability of PrEP in Wales. Now, PrEP is a treatment that can be taken by people who are more at risk from catching HIV to reduce their chances of contracting the virus. But there's much more we can do, especially towards ending HIV-related stigma and eradicating new infections. We know these things are possible. With early detection and medication, people living with HIV now have the same life expectancy as people without HIV, and they cannot pass the virus on. Yn un gwybod bod pethau hyn yn bosibl. Os mae pobl yn darganfod bod HIV arnyn nhw, maen nhw yn gallu cael meddygyniaeth, ac mae gan bobl sy'n byw gyda HIV yr un disgwyliad oes, os mae'r haint yn cael ei ganfod yn gynnar, a phobl HIV, heb HIV erbyn hyn. A mae'n bwysig i nodi nad oes modd iddyn nhw drosglwyddo'r virus os gawn nhw'r help yna yn gynnar. Our draft HIV Action Plan, which I'm launching today, includes 26 wide-ranging actions for how we will meet these targets. It sets out our future approach to prevention, testing, clinical care, living well with HIV, and tackling HIV-related stigma. Our HIV Action Plan working group, which includes the voluntary and community sector, healthcare professionals, academics, and importantly, people with lived experiences, has worked hard on this plan. And I want to draw your attention to some of the key proposals in it. We will prevent future cases by improving access to condoms and medicines which protect you from HIV. We will break down barriers to testing. Every test is an opportunity to prevent transmission. And we'll support people to access specialist HIV services and peer support programs so that they can live well with HIV. Byddwn ni yn atal achosion yn y dyfodol drwy wella mynediad at gondomau a meddygyniaethau sy'n diogelu pobl rhag HIV. Byddwn nhw'n cael gwared ar rwystrau brofion. Mae pob prawf yn gyfle i atal trosglwyddo, a byddwn ni'n cefnogi pobl i gael mynediad at wasanaethau HIV arbenigol a rhaglenni cymorth eraill fel y gallen nhw fyw yn dda gyda HIV. There's no place for ignorance or intolerance in Wales, and this plan sets out actions to tackle this stigma, which sadly continues to be a barrier to preventing new HIV cases. We've seen huge improvements in testing in Wales due to the combination of online testing and face-to-face consultations. And this blended model was introduced during the pandemic. And this makes it easier than ever to get tested for HIV, and more people were tested in Wales between January and March this year than in any previous quarter. Every test helps to prevent transmission, and free testing is available at your GP, sexual health clinic, or you can order a test online. Mae pob prawf yn helpu i atal trosglwyddo, ac mae profion am ddim ar gael gan feddygon teulu neu clinigau iechyd rhywiol, neu allwch chi archebu prawf ar-lein. We're proud to see that new diagnosis of HIV in Wales decreased by 75% in Wales between 2015 and 2021. A significant factor in this has been our policy of making a medicine which protects you and from HIV called PrEP, which has been widely available since 2017 in Wales. But we need to do more to prevent late diagnosis. Of the 48 people who were diagnosed last year, just under half were late diagnoses. Now, late diagnosis is the most important predictor of morbidity and premature mortality. It also increases the risk of onward HIV transmission. We want to support people to get tested, which is why I'm announcing today £3.9 million to continue to develop online HIV and STI testing. Our plan also sets out how we will support people who are newly diagnosed with clinical care and psychological support. We also want to make sure everyone newly diagnosed is seen by a specialist HIV service within 2 weeks of diagnosis. We also plan to develop a national peer support programme for Wales and an HIV awareness programme, including making sure school resources include the latest up-to-date information. Studies have linked stigma to increased risk, non-disclosure and avoidance of health services, including those which may prevent mother-to-child transmission of HIV. Around 1 in 7 people have never told anyone about their HIV status outside a healthcare setting. 1 in 5 have avoided seeking healthcare when they had needed it in the last year because of their HIV status. And most worrying of all, 5% said that they'd been refused healthcare or had delayed a treatment or medical procedure in the last year because of their HIV status. I don't want anyone to feel shame or discriminated against due to their HIV status. The most effective way to address stigma is through education. We'll also develop an HIV awareness training programme to address misunderstanding and stigma in the healthcare sector, which will be mandatory for all healthcare providers. There are 26 actions in the plan and some overarching actions, including turning Wales into a fast-track nation. And this will build on the success of Fast Track Cardiff and Vale, which is a collaboration between public bodies and organisations which created Wales HIV Testing Week and piloted new services. This will support regional networks of health, social care and community groups to reach out to make sure that we reach our 2030 ambitions to eliminate new HIV infections and stigma. And to make this happen, we need to hear from you. If you have lived experience or worked with people with HIV, then please get in touch. Mwyn i hyn ddigwydd, mae angen i ni glywed wrthoch chi. Os oes gyda chi brofiad personol HIV neu os ydych chi wedi gweithio gyda pobl sydd â HIV, please cysylltwch â ni. We're putting this plan out to consultation for 12 weeks to make it as strong as possible so we can make a real difference to the lives of people living with HIV now and in the future. Diolch yn fawr i chi gyd, and now I'm happy to take questions from journalists, and I'll start with Carrie Davis in ITV Wales.
Diolch yn fawr. Thank you, Minister. How realistic is the target given everything else the Welsh Government is trying to achieve by 2030? We've heard about anti-racist Wales, net zero carbon, and now HIV-free Wales as well.
Well, I think the fact we're already on the right trajectory gives us some hope. We've seen those figures tumble in the past few years because of the availability of PrEP, which actually stops people from developing HIV in the first place. So I guess we're encouraging people who are more at risk to come forward to see if they can access PrEP. So actually, you know, we're on a trajectory that looks very hopeful. This additional funding, I hope, will help also in terms of making sure that people access the testing, and they need to come forward early. And that's the key thing for us, is if we get people coming forward early, they get the tests quicker, they get the treatment quicker, and they're less likely to pass it on. And all of that helps us, we hope, to get to the target by 2030.
How much money overall is being invested in this plan then? Because the £3.9 million outlined so far is set aside to further develop online HIV testing. So what's the total figure looking like?
So the total figure, there is of course already some money that is in the system already. So this is additional funding that we are putting in place today. So obviously every health board will have their own figure for how they are dealing with this. So we'd have to look at the breakdown across all the different health boards to get that for you. Dan Bevan. Oh, sorry.
Do you have an estimate, a ballpark figure that you'd be expecting?
Well, we can get that from the different health boards, and we can get that to you if that's okay, Carrie. So Dan Bevan.
Thank you, Minister. Good afternoon to you. We know that one of the underlying problems in the pandemic was the effect that it had on treatment for other conditions beyond COVID. How much of an effect do you think the pandemic has had on plans to eradicate new HIV infections in Wales? And is that the reason why these plans have been stepped up? And if I could have that answer in Welsh and English, that'd be much appreciated.
Thanks. Well, ironically, Dan, one of the things that happened during the pandemic is we were able to do a lot more online requests for testing, and actually what we saw is more people coming forward for testing than we've seen before. So ironically, the pandemic has helped us to get people to step forward who may otherwise not have done so. So I think in that sense it's been a positive move because we've seen those increases in people coming forward as a result of that online availability. Felly, dwi'n yn meddwl bod y ffaith bod y pandemig wedi digwydd wedi golygu bod i ni yn cynnig profion nawr ar-lein mewn ffordd nag o'n i'n wneud yn y gorffennol, a mae mwy o bobl wedi dod ymlaen i ofyn am y profion, ac wrth gwrs y profion a'r profion cynnar sydd yn helpu pobl wedyn i gael y triniaeth sydd angen arnyn nhw fel bod nhw ddim yn pasio HIV ymlaen.
Diolch. And we know, that, of course, on a separate topic, but nevertheless still important, the first plane is due to leave with asylum seekers on board to Rwanda later today. I wonder how you feel about the policy, and does the UK government's policies on immigration affect the Welsh government's ambition to be a nation of sanctuary? And again, in Welsh and English, if you don't mind.
Well, I think we should measure societies on the treatment of its most vulnerable. And these are certainly vulnerable people, people who very often have been subject to very difficult conditions in their home countries. They're fleeing very often the horror of war and lots of human rights abuses in their own countries. And whilst, of course, we're clear that you can't offer asylum to everyone, I think it's absolutely clear from Welsh Government's point of view that you should not be outsourcing your ethical responsibilities to a country where there are very questionable human rights violations. So certainly, as a nation of sanctuary, we are very uncomfortable with the actions of the UK government, and we would like them to think again, because we think this is a very dark day for the UK with this very cruel and human approach to asylum seekers. Dwi'n meddwl bod e'n glir bod cymdeithas, dylai chi beirniadu cymdeithas wrth y ffordd mae nhw'n delio gyda pobl mwy o bregus tu fewn i'r gymdeithas yna. Wrth gwrs mae pobl sydd yn edrych am asylum yn bobl sydd yn aml wedi dioddau lot yn eu gwledydd nhw. Maen nhw'n dod am loches i'n gwlad ni, a dwi'n meddwl bod e'n gwbl anghywir i ni fod mewn sefyllfa lle ni'n allforio ein cyfrifoldebau ethical o ran sut dalen ni fod yn ymdrin â'r pobl yma. Ac yn sicr fel gwlad sydd yn cynnig sanctuary bobl, ni yn siomedig iawn gyda'r ffordd mae Llywodraeth Pryden yn bwriadu bwrw ymlaen gyda'r syniad yma o allforio asylum seekers i Rwanda. Benjamin Price, BBC Wales.
Diolch Gweinidog. Os gallai cael atebion yn Gymraeg hefyd, please. First question. One person with HIV that we've spoken to says he's concerned people aren't taking the risks seriously enough because of the success of preventative measures. Is that a concern that you share?
I think that that's one of the reasons why we're very keen for this action plan to be a success. We're today helping to raise the profile of the fact that actually it is important that you come forward, that there are risks if you're not treated, but actually there are lots of actions you can do. One, to prevent yourself from being infected in the first place, but if you are infected, then of course there are treatments that can help you to live a very normal life if you catch it early enough. And it's that message of making sure if you can take that preventative action, or that action if after you've contracted HIV quickly, so that we can avoid complications from building in the future. Dwi'n meddwl bod e'n bwysig bod y rhaglen yma yn denu sylw at y ffaith fod e'n bwysig bod pobl yn cymryd HIV o ddifri, ond ein bod ni'n tanlinellu'r ffaith bod yna help ar gael i bobl cyn iddyn nhw contractio, os maen nhw mewn sefyllfa o gymryd risgs, allwn ni helpu trwy gynnig prep iddyn nhw, ond hefyd os maen nhw yn cael HIV, mae angen estyn allan am yr help ychwanegol fel bod nhw ddim yn datblygu symptomau sydd yn gallu arwen at problemau fwy hir dymor. Os ych chi yn cael yr help yn gynnar, wedyn mi allwch chi byw bywyd normal, a mae hwnna'n bwysig i ni wrth gwrs fel cymdeithas hefyd.
And we heard earlier this week it takes longer for people in Welsh hospitals to be seen, 7 days on average compared to 4 days in England. So why is the NHS in Wales less efficient?
Well, there are certainly, my officials are looking at the data that has been provided by the Nuffield Trust, trying to break down, and it's certain that the way we count our figures is different once again from the way that's done in England. If you are transferred from one hospital to another, then that doesn't count in England where it does in Wales. So there are some mitigating measures, but I, as Health Minister, can tell you that I'm very focused on this, that we recognise that there are cases where we do need to get people out of our hospital much quicker. Our care service, of course, is in a very fragile state, and we're trying now to see what we can do to go much further in terms of recruiting reablement carers so that we can get people out of hospital quicker, make those assessments in the home, and release those hospital beds for, of course, those emergency cases that are currently accumulating at the back door of at the front door of our hospitals in A&E.
Yn Gymraeg?
Ateb hwnna yn Gymraeg.
Os yn bosib, please.
Yn un ymwybodol iawn fod na pobl falle yn aros yn hirach mewn rhai o'n ysbytai ni yng Nghymru. Mae pobl sy'n gweithio yn yr adran iechyd yn edrych mewn i rhai o'r ffigurau yma, achos mae'r ffordd yn ni'n cyfri'n wahanol i'r ffyrdd maen nhw'n cyfri yn Lloegr, enghraifft, os mae rhywun yn claf yn symud o un ysbyty i'r llall, yn Lloegr mae'r cloc yn dechrau unwaith eto. Dyw hynny ddim yn digwydd yng Nghymru. Ond mae system gofal yn un fregus dros ben, nid jyst yma yng Nghymru, ond hefyd yn Lloegr. Ond ni'n gweithio ar hyn yn drwyadl iawn ar hyn o bryd, ac yn edrych i weld os allan ni recrwtio mwy o bobl dros yr haf, fel bod ni'n barod am y geia nesaf, ac yn gallu stopio cymaint o bobl yn aros am eu triniaethau nhw wrth y drws ffrynt, wrth gwrs, gyda accident and emergency dan bwysau llethol ar hyn o bryd. Will Hayward.
Thank you, Minister. There is huge pressure at the moment on waiting lists and ambulances, and there has been for years, even before COVID. People want to know when it's going to get better. Can you guarantee people in Wales that this time next year the situation will have significantly improved?
Well, I can assure you, Will, that all of my efforts at the moment are being put into trying to take the pressure off hospitals. It's very complicated jigsaw that we have to put together, because it is a huge system that goes from the red ambulance call through to the fragility of our care system. And we need to sort out the system all along. And that is certainly something that I'm very focused on, working with my colleague Julie Morgan to make sure that we work with local authorities to try and do what we can to reinforce the support that is given in the care service. If we can release more people from hospitals, there's still around 1,000 people in hospital beds who should be ready to go back to their communities. But that recruitment issue, which of course we've tried to address through introducing the real living wage, is something that we're trying to do to try to address. But I can assure you, Will, that we are putting a lot of effort into this. We know that it's been a very tough year and that the year is not over, but we're also very aware that we could hit another COVID wave in the winter. We could see more flu next winter. And so we're putting those preparation measures in place now. And that means recruitment, training of additional people beyond what we'd already planned for.
Okay, we've seen COVID cases and hospitalisations rise in England. Do you expect to see this in Wales? If so, when? And if is the Welsh NHS in a position to cope with it, given the current pressures and the backlog?
Well, I'm pleased to say that our COVID rates have been going down. So at the moment, we're in a good situation. We are obviously making sure that we keep an eye on the situation, that we're analysing it. We've in this situation now where about 1 in 75 people in our communities are living with COVID. What we're trying to do, Will, to avoid that situation from happening is to make sure that we are ready for an autumn booster campaign. We're just finishing off the spring campaign now, making sure that the most vulnerable are protected. But the best hope for us to keep people out of hospital is to make sure that autumn booster campaign is in the place where it should be. And certainly I know that health boards across Wales are working hard to make sure that strategy is in place. Harry Hansen.
Thank you. Good afternoon, Minister. You've mentioned today about the introduction of HIV education into the curriculum. You know, how is that really going to effectively be carried out across schools in Wales? Well,
as you know, Harry, there's a new curriculum that's being introduced, and so it'll be important that teachers take account of that new curriculum and the extra flexibility that curriculum allows to make sure that they introduce this subject in a sensitive and a timely manner. But what is important is that nobody lives in ignorance in relation to HIV. The dark days of the 1980s, where HIV very often led to AIDS and very often to death, are very much behind us, very much behind us. We now have the ability to address these issues, and it's really important that people get up to date with the changes that have happened since the 1980s. So we genuinely think that this is something within our reach, that we can get to 2030, and that we will be able to see no more cases of HIV in Wales.
Thank you for that. And I suppose on a slightly different note, how concerned is the government that Wales has the highest proportion of GPs over 60 in the UK? You know, almost a quarter of GPs in Wales are approaching or at retirement age.
We are very aware of that, and of course we are making sure that we're in a situation where we are preparing for the support that we can. We've got a different model in Wales where we're trying to make sure that we get people like advanced nurse practitioners from who can help us out. If you look at the number of GPs in Wales compared to England, of course the Nuffield Trust came out with that report recently. There are 63 GPs per 100,000 people in Wales compared to 57 GPs per 100,000 in England. In the last 3 years, we've recruited 90 more doctors than the original target, which was 160 per year. And of course, we have got the new medical school opening in North Wales, and that already is recruiting people into Cardiff, people who will then be transferred into North Wales. Tom Magna.
Good afternoon, Minister. Appreciate you're here to speak about HIV principally. You mentioned a few moments ago about working with local authorities. Unpaid carers have the right to needs assessment under the Social Services Wellbeing Wales Act, but yet I'm hearing from increasing numbers of viewers to carers worldwide who are telling me they're being poorly treated by local authorities. What intervention will you make as the responsible minister to ensure that unpaid carers have the highest priority for prompt, accurate and compassionate needs assessment from local authorities, given that unpaid carers provide 96% of care across the nation?
Thanks very much, Tom. And I'd like to put on record once again our thanks to those, that army of unpaid carers who very much are helping us out as a society. As you're aware, Tom, we are trying to show our appreciation for that through a number of ways. So first of all, we have invested 4.5 million into Carer Support Fund over the next 3 years. And this will provide grants to help unpaid carers with the rising costs of living. We've announced a one-off £500 payment for unpaid carers receiving carers allowance. That was in March 2022 as a part of a £29 million package. And a £9 million scheme was announced in April 22 to help unpaid carers take a break from their caring role. Now, you're absolutely right that it's important that local authorities step into this position and make sure that those assessments are promptly made.
Thank you for that. I'm sure our viewers are grateful for the extra money, but 5 years on, the Act is ineffective, according to Carers Wales. Local authorities seem unwilling to get on with the job, according to our viewers. How can you be satisfied that all is well without these assessments? Without these assessments, unpaid carers can't get the support they so desperately need over and above any extra money.
What I can tell you, Tom, is that we spend about 30% more on care than they do in England. This is something, again, that came from the Nuffield Trust's investigations. And so I think it is important that people understand that we absolutely are committed to this space and are massively appreciative of the incredible work that our unpaid carers do. Diolch yn fawr iawn i chi gyd. Thank you very much.